I'm Amy Beth Shaver with Allison Sinclair, and we are joined by Admiral Brian Christine, who is the Assistant Secretary for Health at HHS, and it is a thrill and it is an honor, sir, to have you here. Thank you.
Oh, it's a privilege to be here. It is so fun to have come back home to Sweet Home, Alabama, to come see my family and to do this, to work with y'all, to do this podcast, to help get the messaging out that we need to, so the American people know the good things that we're doing in Washington, the good things that Secretary Kennedy and President Trump are doing. And so as we start off, I have to give a shout out, obviously, to our president and to Secretary Kennedy, because they are working so hard to make this country healthier than she's ever been, to make Americans stronger than we've ever been, to make America great again. So thanks for the opportunity.
So before we jump into those values issues and talking about making our country healthy again, which is such a relief, could you tell those who may not know you or have heard about you, because you are a legend, a little bit about your background?
Sure.
As we jump in.
Yeah, absolutely. So I was born, my father was in the Army. I was born in what used to be West Germany. Now, if you're old enough like me, you remember that one time there was an East and a West Germany during the Cold War. My father was a tanker. In other words, he was in armor in the Army, tanks. And we had a lot of armor assets deployed along the East-West border during that time. I was born in 1963, really the height of the Cold War. So I was born in West Germany. My father ultimately went Special Forces. In his second tour of Vietnam, he was really severely injured, lost an arm and a leg, got out of the military. We ultimately settled in Augusta, Georgia, had some family there. I went to medical school at Emory in Atlanta, and then I came over to UAB for my residency, and that's how I got to Birmingham. I did my residency in urologic surgery, completed my residency, and then I joined a urology group here in Birmingham, and I practiced with that group for 24, 25 years, really subspecializing in men's health. That was kind of my gig. Then I got the call for the nomination to be the Assistant Secretary for Health from President Trump. Went through the confirmation process. Ultimately was confirmed by the Senate. I was confirmed into this position last November, and here you are. So now I'm in Washington as the Assistant Secretary for Health.
Were you expecting that call? I mean, how does this happen?
Yeah,
you're just like
that's a great
Brian
question.
Christine in Birmingham, Alabama, and you get a call that you're the next Rachel Levine. What's her boy name?
Richard.
Richard Levine. Richard Levine.
You're
That's
Richard,
exactly right.
Yeah.
Yes, I am President Trump upgrade from Richard Levine.
We would say
there
so.
We're very grateful for you.
Yeah, exactly. And I really think, listen, I think one of the reasons that President Trump nominated me and that Secretary Kennedy wanted me in the position is because I practiced medicine on the front lines. I was kind of a Main Street doctor. And I think they liked the idea of having someone who really understood medical care and delivery from a Main Street level. Personally, I think also one of the reasons that President Trump wanted me in this position, because there's really not another visual that shows the difference between the horrible Biden administration and the really righteous and good Trump administration, and the fact that you have me in the same position as Levine. I'm a man who wears men's clothing, and that really says all you need to know about the last administration and this administration. For sure.
I always thought he could have done a better job, like zhuzhing it up a little bit. Like it was like he put on some earrings and a dress, and that was it. Like, but we can work a little harder. But I think America, the juxtaposition is overwhelming from what y'all are doing versus what he was doing.
Well, no, exactly. When you look at Levine, I mean, again, his agenda was, no question about it, the transgender and minors agenda was so important for him. All he wanted to do was to tell little boys they could be little girls, little girls they could be little boys, and then recommend castrating surgeries, castrating chemicals, hormones, and do irreversible harm to these kids. So if you go back and look at what he talked about, mostly that was it. I mean, Levine advocated for removing any kind of age restriction on transgender treatment in kids. He advocated for those sex-rejecting surgeries. That's what we call them. People say transgender surgery. No, in this administration, we talk about sex-rejecting surgeries and procedures because that's what they are. And that was his big focus, right? I personally believe he was in that position as a statement. I personally believe he was in that position to be an eyepiece, not because he really cared about the health of the country. So I'm really happy to be in this position to be able to reverse and to right so many of the wrongs that the last administration and Levine, perpetrated on the country.
Mm-hmm. So in this position, you're able to do a lot of good. Could you talk to us about your roles and responsibilities?
Sure. As the Assistant Secretary for Health, you have kind of a 3-level role. One is to help form healthcare policy, to work across the different divisions of the Department of Health and Human Services, to work with the CDC and NIH and FDA, and work with HHS leadership to help form healthcare policy. So we help form the policy. We help implement that policy. There's also a communication role, which really appeals to me, in that we help to communicate the policy to healthcare establishments, healthcare providers, and to the country at large. Okay, the Surgeon General falls under the Assistant Secretary for Health. So when we have our new Surgeon General in, and I'm happy to say that Dr. Casey Means will be having her hearing before the Senate on the 25th of this month, I believe. She'll be an amazing Surgeon General. We're going to work so well together. But together we'll be advancing the message of the Department of Health and Human Services and President Trump to the American people. So there's that communication aspect to the role. And then also, the Assistant Secretary for Health can serve as a civilian, or they can do as I did, which is request commission from the president. So I have been commissioned as the senior admiral at the Public Health Service, specifically the Commission Corps. So you have the U.S. Public Health Service, and then you have something called the Commission Corps, and these are commissioned officers. I'm a 4-star admiral. I lead the Commission Corps, and so one of the other roles I have is as a flag officer and admiral is to lead the Commission Corps of the Public Health Service, and that's about 5,400 doctors, nurses, pharmacists, therapists. Believe it or not, we've got a few veterinarians in there as well, dentists, dermatologists. We are Secretary Kennedy's tip of the spear strike force for public health initiatives. And it's really a privilege to wear this uniform. It's a privilege to receive the salutes that I receive from other members of other uniformed services and my own officers. To wear this uniform is a privilege, but that's a big part of what I do, is to lead the Commission Corps, because we really are the edge of the knife, the tip of the spear for public health in the United States. And I have officers deployed other parts of the world as well, primarily in the U.S. We work at Guantanamo Bay, for instance. We work with ICE agencies. We work with DHS. We supply doctors and nurses to the Indian Health Service, which is a big role. We have officers that work at FDA, work at CDC. They're out in community health centers. So we're all over the place, but that's part of my role as well.
Wow.
That's a lot of people.
It's a lot of people.
I had no idea.
It's a lot of people. And these officers, these are good men and women. These are good men and women who want to serve, who care about this country. And one of the things I have been told by officer after officer is they said, we are so happy that we have a new Assistant Secretary for Health. We're demoralized by our prior Assistant Secretary because we knew he didn't really care about us. He put the uniform on as a political stunt. Brian, you wear the uniform because you care about the country and you want to serve the President and the Secretary.
So going into this role, like, you're just kind of starting. If now, and hopefully we'll do an interview as you're leaving and we can reassess, but give us your top 3, like, these are the things that I definitely want to get done while I'm here. What would those be?
Yeah, and so my agenda is, of course, Secretary Kennedy's agenda and the President's agenda. We all work for the President. He is the Commander-in-Chief. I work with Secretary Kennedy as we both serve the President and serve the people. And so the things that are really important to us at the Department of Health and Human Services, we know that affordability of health care, affordability of drugs, making sure we have good health care delivered to everybody, whether it be in a city or in these rural environments, that is something incredibly important to the President and the Secretary and myself. Also, we have our values issues. In other words, and we can talk about this, right to life issues, respect for the dignity of every man, woman, and child in this country. That's incredibly important to us. Taking care of men, taking care of women, that's important. So affordability, these values issues, and doing everything so different from the last administration and the last Department of Health and Human Services. We absolutely are guided by science. That's something that Secretary Kennedy has said again and again. We are guided by gold standard science, and we use that science to form policy and to do things that are going to make America healthier than she's ever been.
Okay, but Dr. Fauci says he is science. So are we Dr. Fauci science, or are we like?
Nope.
How do you?
Are we science?
We are science. We are science. Listen, people can think what they want about Dr. Fauci. I prefer not to think about Dr. Fauci. I don't have much regard or respect for that individual. But who I do have regard and respect for are RFK, Robert F. Kennedy Jr., Jay Bhattacharya, Dr. Bhattacharya, who was so incredibly strong during the COVID pandemic. He leads the NIH, the National Institutes of Health. I have respect for Dr. Oz, Mehmet Oz, who heads up CMS, Medicare and Medicaid. He is amazingly brilliant, amazingly committed to this country. We have Marty McCary, who is out at FDA. Marty also cares deeply. We don't have a CDC director right now. The interim director is a man named Jim O'Neill. Jim is also the deputy secretary at HHS, incredibly smart, incredibly strong, committed to life, committed to science. So those are the people I think about. I don't worry about Anthony Fauci. I don't want to think about Anthony Fauci. He did enough harm to this country. Yeah. I think about President Trump and our team now at HHS because we're doing amazing things.
You clearly are. So could we jump in then to those values issues that you've mentioned? Top of the list, right to life.
Yes.
And underneath that would be people's concern about Mifepristone.
Sure.
Could you talk to us about that a little bit?
Yeah, I think, I'm 62 years old, turned 62 in December. This is the most pro-life administration that I've ever seen in my 6 decades plus of life. There's no question about it. The most pro-life administration that I've ever seen. I think the administration that is friendliest to religion and faith that I've ever seen. And President Trump has demonstrated that again and again. We stand for life. We stand for the fact that we know that life begins at conception. We respect life until life's natural end. We respect the dignity of the person. We want to make sure that we stand with individuals who believe those same things, and we do. The recent March for Life, you saw that Vice President Vance address the country. The next day, there was a breakfast that was basically for all of the youth, the young men and women who'd come into this country come into the city from across the country. There was a breakfast that morning. Jim O'Neill, the deputy secretary, and myself, we addressed those students, and there were over 2,000 people there. And we talked about the fact, what we're doing for life, the fact that we know little boys are little boys and little girls are little girls, the fact that we know life begins at conception, the fact that we are doing things like, for instance, through my office, the Office of the Assistant Secretary for Health, we administer the Title X funds. So let me tell you, so just recently, because of our oversight, directed by Secretary Kennedy, our oversight over Title X funds, $2.3 million of grants that had been given before us had to be returned by Planned Parenthood. $2.3 million that will no longer go to killing children. $2.3 million that will no longer go to lying to women. Because of our oversight, they gave that money back, which is a huge victory. Absolutely. We make sure that we're enforcing the Hyde Amendment. President Trump, Secretary Kennedy, and myself, we are strong for this. No federal dollars are going to go toward abortion or procuring abortion services. We are strong with the Hyde Amendment, and we are making sure the Hyde Amendment is being enforced, unlike the last administration. Yes. We have made sure that monies, that when you have youth, children or youths, young girls who are taken in custody coming across the border or something, that federal dollars cannot go to providing abortion services, because that was going on in the last administration. Just totally disregarding the Hyde Amendment. We stand strong. That's no longer happening. So for those right-to-life issues, we've been incredibly strong about that, and we're very vocal about that. Again, one of the things that impresses me most about Robert F. Kennedy Jr., and he's always been this way, he really realizes that God has given an inherent dignity to every man, woman, and child, and we respect that dignity.
As an adopted person, and I know as an adoptive mother, we are so thankful for those policies. And as women who've lived through the nonsense, that the lies that have been heaped upon us, that you have to kill your child to have a life.
That's right.
We're very grateful for your stand in that regard.
Again, all of this is a privilege, but we have to do it for the country. We have to and we have to remember too that all of the wins that we have in this administration and this Department of Health and Human Services, it only takes one election cycle for things to reverse. And so we can talk about this more later, but it's incredibly important for us as conservatives, for us as people of faith to be motivated to vote in November, to get out, support those candidates who stand with President Trump and his agenda. It's going to be more important than it's ever been. I know every election it's like, this is the most important. So I'm not going to use that hyperbole, but this is an incredibly important election in November. So I want all of the people, all of the men and women who watch this podcast, who listen to this podcast, and there are so many, I want them all to know, tell your friends, tell your families, we've got to be out there supporting candidates in congressional districts and Senate races that support the president in November.
You posted recently about gender affirming care, gender dysphoria, and kind of your work, and you just mentioned, right to life. That I would agree that is a life issue. Were you surprised when the American Medical Association came out recently and said that gender affirming care, genital mutilation, all that should be put off till adulthood? And do you think that we're maybe turning a corner on all this?
I think that is I'm so glad you asked that question because, yes, so the American Medical Association is certainly backing away from its prior stance. It was the Academy of Plastic Surgeons. I think that's the right name. The Academy of Plastic Surgeons that said, and this is landmark, they said just this past week that we recommend that we don't do those mutilating surgeries, what we call the sex-rejecting surgeries on anybody under the age of 19. That is huge. Mm-hmm. That is huge. And I think we are turning this corner. We can never take our foot off the accelerator because I like to say that gender theory is like a vampire. Mm. It'll come back. Mm. You may think you've killed it, but it'll come back in the next hostile administration. So we always have to keep our foot on the accelerator for this, and we are, and I am, and President Trump certainly is. But yeah, I hope that we've turned a corner. I really do. This really started with, again, science. So we released at HHS, we released something called the Gender Dysphoria Report, and that was back in the fall. We released this report that basically looked at all the science, and we said, no, the wrong way to treat these children is to perform castrating surgeries. The wrong way to treat these children is to use sex-rejecting chemicals and hormones. The right way to treat these children is with compassionate, competent mental health care. Now, personally, as a person of faith, I personally believe that if the child's parents want this, I think pastoral care is incredibly important to support these kids, right? But we initiated that report. The report was released, and then we did something even more. We had what was called the peer review of that report. So we invited scientists, not all of whom were aligned with us, to say, review this report. Tell us what you think. Put your politics aside. Go by the science. And they had to say, you're right. The science backs up exactly what you're saying about this. So I think things like we're seeing with the plastic surgeons, things like hopefully we're going to be seeing more with the AMA, really the shot across the bow was the gender dysphoria report. Mm-hmm. Because, again, Secretary Kennedy has always said, we use gold standard science to guide our decisions. That's gold standard science. Those kind of things, sex-rejecting surgeries, horrible chemicals and mutilations, that's not the way to treat these kids. I am not going to take my foot off the accelerator on this because, like I said, it is a vampire. If we don't stake it through the heart and if we don't kill this whole gender theory, it's going to come back in the next hostile administration. No question about it. So we're doing great things with that. And that, as far as values, very important to the president, very important to the vice president, very important to Secretary Kennedy and myself.
Can I ask a follow-up question real quick?
Yeah.
Don't forget what you were about to say.
Okay.
So RFK's ideas, like inverting the food pyramid, are seen as kind of controversial. Some of his suggestions on treatments and things like that. To me, there's more science behind what he's saying than what we've been told for all these years. Yeah. I think now, especially after COVID, we're seeing, wait a second, have we been lied to? You're all changing the vaccine schedule for childhood vaccines is huge. But how do you balance that? And do you see much pushback? Because you're saying gold standard science, but a lot of it, people are like, this is new to them.
Well, science is dynamic. Right. It's not static. Science changes over time. I'm a physician. I'm a surgeon. I'm a scientist. The way I do things, and I've closed my practice to be in this job, but the way I did things, for instance, in 2025 when I was still practicing, were very different than I was trained 20 years earlier or even 10 years earlier because science is dynamic and changes. And that's what Secretary Kennedy has said. What he has said is we always follow the science, but we have to be nimble enough and we have to be honest enough to say that if the science leads us in a different direction than it has in the past, that we are brave enough and we care enough about this country to make those changes. And that's exactly what you're seeing. You mentioned about the vaccines. I mean, let me be very clear about this. And I'm glad you brought this up, Allison, because this is very important. Mm-hmm. Secretary Kennedy has not taken a vaccine away from anyone. Despite what the lying left will tell you, he has not taken a vaccine away from anyone. Now, what he has said is that we want people to decide what's right for themselves. Yes. We want parents to decide what's right for their kids. We want to put knowledge in their hands so they can make the best decision for them. He has not taken a vaccine away from anyone or anybody. Vaccines are still available. We did look at the recommendations, what the vaccine, the child vaccine schedule should be. And it wasn't just this was willy-nilly. No, what happened is the president said we need to look at this. And so what did we do? We went and we compared the vaccine schedule for children for other countries, other peer countries, countries like ourselves, advanced countries, and said, what are they doing? And we looked and found out that what we were doing was not in line, and they had good science backing them up. So all we did was we went from 17 to 10 vaccinations recommended, but we're not preventing anybody from getting a vaccine. What we've simply done is look at the science and say, this is what the science suggests. So Robert F. Kennedy has not pulled vaccines from anybody. He's not preventing anybody from getting a vaccine. He's simply saying, Mom and Dad, you make the decision for your kids. What we're not going to have in this administration is a government forcing and mandating vaccines into our bodies or medicines down our throat or advocating for cutting our children's body parts off for some left radical, really sick ideology.
I mean, we talk about all the time the regret we have. Like, in
Awful.
what world is it a good idea to take your 6-week-old and get jabbed with 4 different chemicals in one? I mean, but we trusted our doctors, and I think our doctors were just doing what they were told in medical school based on science. So very grateful for that, because I feel like Abs and I are always like, we need to go apologize to our kids.
We really
should
do.
know better.
Well, I think it's, again, we have to be led by science, like I said, but we have to empower patients. I mean, as a surgeon, I lived and died by informed consent. I had patients who I said, maybe I diagnosed a prostate cancer, and I said, here's your treatment options, sir. Here's what I think is best. Here's the options. What's right for you? And if they made a decision that I disagreed with, I didn't abandon them. I said, I respect you. We respect people's right, or we respect their intellect to make a decision for themselves. It's all about informed consent. What you will never see this administration, and what you will never see me or Secretary Kennedy or Dr. Oz or Dr. Bhattacharya, you'll never see us try to force our personal agenda on people. We'll always be guided by science, and we'll always give them the ability to make the decisions for their own health.
And you would think post-COVID, people would be thrilled for that. And yet there still seems to be pushback on that idea. There's pushback on the COVID vaccine still. I have young grandchildren. It's still pushed on them. Can you speak to that at all? Because it's unbelievable after all we've learned, after the evidence that's presented itself, that there would be any pushback at all. That we'd say, no, we really do want to make the decision for ourselves. We want to make the decision for our children. We're not anti-science. We're not vaccine deniers.
That's exactly right.
That's not who we are.
We aren't. I've heard Secretary Kennedy say in his confirmation hearing, just like I said in my confirmation hearing, listen, we know vaccines can save lives. We also know not every vaccine is the same. We also know not every vaccine is right for every individual. So you would think people would be happy to have us be able and empower folks to make their own decisions. But again, I think there are those on the left, there are those who hate the president, they hate the secretary, they really hate the ability of people to think for themselves.
Yes.
Right? So they don't support our agenda, which our agenda is health and freedom.
And we're so glad. So I'll save it.
No, if you're on the track, go. Stay
Well,
on the
I
track.
wanted to talk food pyramid.
Oh, that's
good.
actually where I was going to go.
Okay, perfect. Same brain as always.
Great. I'm glad, because this is important. The new dietary guidelines are absolutely incredible. They are amazing. And so what law requires is that at least every 5 years, new guidelines come out. And so when you look at the guidelines from the past, particularly the recommendations that were made by the prior administration, it was just pushing highly processed, highly sugary, fake food on the American people. Why do we have an obesity epidemic in this country among kids, among adults? At least part because of the junk food that that are pushed down our throat. And our dietary guidelines do, just like you said, Allison, we've taken the pyramid and we've flipped it. What we are doing now is we are emphasizing protein. We're emphasizing whole foods, nutrient-dense foods. We're emphasizing protein gotten through meats and fish, eggs. We're emphasizing whole-fat dairy because that's really healthy. We're telling people, don't be afraid of saturated fat in your diet, right? Don't be afraid. Fat is not our body needs fat.
Yep.
Our nervous system needs fat. We have to have fat. Now, we aren't saying go out and overindulge in fat, but what we're saying is don't be afraid of it. We're saying get your protein, get your nutrients, get your carbohydrates from whole, nutrient-dense food, and move away from sugary, fake, processed food. That's all we've said. And I'm telling you, this is going to make a difference in the health of this country, and it makes a difference in affordability. And I really want to touch on that as we talk more about it.
Yeah. Quick question before we do jump into affordability, because I think that's on everybody's mind. What took so long? Why wasn't the food pyramid inverted before now?
That is a great question. I tell you, there are a lot of forces out there. There's a lot of big pharma. There's a lot of big agriculture. A lot of individuals with a lot of money who really love to see sugary processed foods. Think about that. If you can get kids and adults in this country eating, and I don't want to pick on any particular product, but eating a sugary cereal for breakfast every morning, that's a heck of a lot of money that you make in your pocket as that industry. So there's a reason to push those foods. I think that's part of it. But one thing I will say about Secretary Kennedy is I've described him as being a John the Baptist for our times, because he has been a voice crying out in the wilderness, we're poisoning our kids. We're over-medicalizing people. We are destroying this country from within by bad health decisions. He's been a voice crying out, and so flipping the pyramid, making this is just an example of the kind of radical change that we see with this administration and Secretary Kennedy, all for the good.
I just have to say that I'm really, about a year and a half ago, I cut out all seed oils. I actually upped my salt intake. I add in like organic avocado oil or olive oil. Like I actually add oil to things. I mean, and it flies in the face of everything. I mean, I promise Lucky Charms were the base of the food pyramid when I was growing up.
I understand exactly what you're saying, because I do too. Like, yesterday for breakfast, before I flew down, made myself some eggs for breakfast, and I poured some olive oil on them, a little bit of salt and pepper,
some ghee.
Yeah, you don't be afraid of those things.
Yeah. Right.
Our guidelines teach us to eat the way our bodies have always been meant to eat.
Right.
Not Lucky Charms or whatever the sugary garbage food you want, right? No, not that. Eat whole foods.
Right.
Eat nutrient-dense foods. And listen, affordability plays a role, or the guidelines rather play a role in affordability. People don't think about this. If you eat the way the guidelines suggest, in other words, if you go out and you buy a pound of ground beef, how many hamburger patties can you make from that? You can feed your whole family, as opposed to going to buy one lousy food, burger from some company out there that's a fake food. If you eat the way the guidelines suggest, whole fruits and vegetables, whole nutrient-dense food, it is cheaper. It will put money in Americans' pockets. It is affordability immediately in your pocket. I know, because I've done it. I've looked at this, and I do it now, and I tabulate what I would normally spend if I were not following our guidelines. You're going to save money by doing that, and in the long run, our country will be healthier. There will be less obesity. There will be less heart disease, less chronic disease, and things will be cheaper that way too. But there's immediate affordability with our guidelines if people really try it out, if people really embrace these guidelines.
How do you respond, though, when people say, well, what about the food deserts? What about the rural areas that don't have access to whole, fresh foods?
I think that's great. No, I think that's a real concern. How do we water those food deserts, if you will? And that's important, and we are certainly working on that. There's the rural health transformation, $50 billion from the federal government that will go to certain states. Alabama has received over $200 million of that. That, I think, $203 million was the statistic that I got this morning when I was checking on that. What's that going to go to? Bringing better health care to rural areas like we have in Alabama and other states, bringing quality health care, improving health care outcomes, educating people about the right foods to eat. And yes, there's a role for trying to get rid of these food deserts as well. But there's so much going on in this administration that we're doing that are win, 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 win. It's promises made, promises kept by President Trump, Secretary Kennedy, and everybody, all of us who work at the Department of Health and Human Services.
Could we talk a little bit more? I remember years ago the rural medicine push. My husband's a gastroenterologist, so I was with him, remembering hearing all of that. Seemed to get better. Now it seems that we're back scrambling, trying to get that rural healthcare situated again. Mm-hmm. Can you talk to us about that in a little more in depth?
Sure. I think this is the perfect example of how President Trump cares about everybody in this country. You know, we don't just care as conservatives and as Republicans and as members of this administration. We don't care just about the big cities. We care about every part of the country, and we certainly have rural areas that they are facing challenges for healthcare access. And so this rural health transformation is hopefully going to help improve those situations. Again, like I said, $50 billion going out to states, our own state, Alabama, benefiting, other states benefiting as well. But no, President Trump realizes we have to make America greater than she's ever been, we have to make America healthier than she's ever been, and this is going to be part of that.
That's great.
Are there any other issues that you want to touch on or things you're working on? And initiatives.
Sure. I want to say one thing about some values issues, and then I would like to talk about some things we're doing for affordability and such in the administration.
And talk about Trump RX. Because are y'all part of that?
Yeah. So the Trump RX, great idea. The idea being is that people are going to be able to be linked up with ways to get the most affordable drugs they can. Again, this is going to put money in people's pockets immediately and today. Trump RX is a great program. Again, helping people to get linked up to get the drugs that they need at the lowest prices they can get. So yes, incredibly important. The last on the values issues, going back for just a second, one of the things that I think is incredibly important is that we see the rise, unfortunately, in this country of what people will say physician-assisted suicide. I call it euthanasia. I call it physicians and nurses helping murder people. We see this on the rise in this country. If you look at countries like Canada, it's one of the leading causes of death. Yeah. Canada was so proud of itself, this was several months ago, because someone who had been, who had euthanasia, who chose to die by their own hand or a doctor's hand, they donated those organs. That's a horrible precedent to set.
Good grief.
We have states in this country that have adopted bills or adopted those laws. I think most recently it is Governor Pritzker in Illinois has signed a bill into law to allow euthanasia. Governor Hochul is considering that. She will probably sign that in New York. Listen, we've been down this road before. If you look back in the 30s and 40s in Germany, the T4 program, which was the euthanasia program, to relieve the society of the burden of life, quote, they said, life unworth living. Since when do we become God and judge? No life is unworth living. That doesn't mean there's not suffering. But when you say I take the most vulnerable, whether they be kids with a terrible cancer or adults at the end of their life, and we say that life is not worth living, so we're going to kill them off, that's a huge problem. It is a really dark slope, a really dark precedent, and I feel very strongly about that. I have an op-ed that I wrote that is going to be released on Breitbart that addresses this. That is something we take very seriously in this administration.
It's one you don't really think about.
You really don't. And yet, I think maybe it was Francis Schaeffer way back in the 70s who said that if we are going to allow abortion, the logical conclusion can only be euthanasia. And back then you go, oh, that's ridiculous. And here we are.
Right. I mean, let's face it. We remember what Bill Clinton, safe and rare, talking about abortion, right? Now what is it? Now it's Katie bar the door, all the way up until the day of birth or, goodness gracious, during labor. So you're right. You look at something like that, and that person was a prophet so long ago to talk about that.
So could we, values issue, your choice, because you're you.
Yep.
Values issue, or could we go to affordability for one quick second? I wanted to ask you about PBMs and where things stand with pharmacy benefit managers, because as I understand it, y'all are working on that,
That's right.
helping people make drugs more affordable. We have someone in our household who takes a medication, and without help, it is a ridiculous price. So we're very thankful for the work that you're doing. But could you speak to the pharmacy benefit manager and their role in perhaps keeping drugs more inflated than they should be?
Sure. I mean, I think if you look, everything President Trump is doing, everything that we're doing at HHS, and a lot of this falls under Dr. Oz at CMS, Medicare, Medicaid, everything that we're doing is to reduce drug prices for people in this country. President Trump has worked hard to bring what we call most favored nation pricing. In other words, people in this country paying prices for drugs that are commensurate or the same as other countries, as opposed to these jacked up and ramped up prices. There are so many things President Trump is doing to work to lower drug prices for all of us. The PBMs are right. That's an area some people call them the middlemen or the middle managers. Everything that we're doing is trying to lower drug prices for people in this country. You mentioned Trump RX. Again, a huge step forward to help people connect with how they get the drugs at the lowest prices they can. Absolutely. If you look, there are, through CMS, there are drugs that are used for cancer treatment and chronic disease where we're working hard, and we have lowered those prices, producing incredible cost savings. We've seen that compared to last year. There's going to be more price savings and more drugs on that list. The prices are coming down in 2026 and more even in 2027. Again, working to lower the cost of these drugs that are important to treat cancer or to treat chronic disease. We are winning on the front of bringing down drug pricing. Are we winning fast enough? Listen, President Trump will always say, no matter how good we do, we could always do better. He is such a lion to move things forward. So we're working hard on that, and we're pushing forward. We want drugs to be as affordable as they can for people in this country. And again, there are concrete things that we have done that have dropped the drug prices down. There is a role to play also thinking about Medicaid services. You know, prescription drugs in Medicaid account for over $100 billion. Again, actively, there is a program out that states can opt into where they're getting lower prices for prescription drugs for Medicaid patients. And you may say, well, Medicaid doesn't affect me. But again, when you think $100 billion or more, it affects all of us because all of us are paying into that. We have lowered drug prices for Medicaid patients if these states opt into the program. The program is called the Generous Program. It's an acronym. The idea of lowering these prices, that's putting money back in the pockets of all Americans, those of us who pay federal taxes anyway.
Yeah.
So we are winning on all fronts when it comes to lowering drug prices, but there's more that we're doing. There's more to come, but we've done concrete things already.
Can y'all do anything about stopping Big Pharma from advertising every single slot during every single football game or thing I want to watch? It's really annoying.
I am
true.
so happy that you asked that.
Well, good, because I'm expecting you to handle it.
I'm so happy you asked that. So after I had my confirmation hearing in July, and that was before I had my confirmation vote, but I had my hearing. We felt good about things. I closed my practice here in Birmingham, and I wanted to move up to Washington. And so I reached out to the commissioner at FDA, Marty McCary, because I know Marty. I said, Marty, can I come work as an advisor? Can I come work at the FDA? So I worked for about 3 months at FDA before I got confirmed into my position that I'm in now. One of the things that Marty tasked me to do when I was there was to work on this very issue, the direct-to-consumer marketing. Yeah. And if you remember back in the fall, there was a huge announcement because we had sent out multiple warning letters to companies saying, you can't advertise the way you're doing. Because you'd have these advertisements, you've seen them, we've all seen them on TV, where you have people dancing around and looking happy, and then they put in the fine print for 10 seconds, the drug may cause suicidal ideation or death, It's unfair marketing. It's lying to the American people. So yes, we are working on that. We've done more than any other administration to send these letters to stop these ads. Okay, there's more work to be done. But at the last administration, virtually nothing being done. Now, is that because they were in cahoots with Big Pharma? That's what I think personally. But regardless, they were doing nothing. This administration, Secretary Kennedy, we're really addressing that problem. We do have more to do, but we've done so much more than has been done previously.
Yeah, I actually, if you stop and listen, you're like, why would anyone want to take that? Like, you're surely going to die.
Yeah.
And some of the side effects are kind of funky. You're like, I don't know if I want that.
We want companies to have to be able to tell the American people with their ads, these are the potential risk of this drug. Again, it all goes back to informed consent. Mm-hmm. Americans need to understand what the risks are and the benefits are of anything, whether it be a surgery, whether it be a drug. We want to hold the companies accountable for that, and we are doing that.
Well, I just kind of want them gone. This is like, you're watching like the Alabama-Auburn basketball game today, and you're like having a great time, and then all of a sudden you got to think about, well, I might have kidney disease, and should I take that? Like, this is just ruining my day.
Well, they're just they're just not realistic. If you had, in my personal opinion, if you had an ad where they said, listen, this is the drug, this is a condition it treats, these are all the potential risks, talk to your doctor that you trust and make a decision, great. But no, the ads are the people dancing around and jumping around and showing their best life in the fine print when they talk about the things you're talking about. They're not honest. We are working to improve that. We've done so much more than any other administration has done. But you're right, we need to work harder, and we are. I promise you, we are.
I believe you.
Yeah, we do. So what are other issues that we may not have covered yet that you want to make sure and talk about?
For years, we've known, those of us who are conservative, we knew that, for instance, in Medicaid programs, there was fraud going on.
Yeah.
Right. So what do you see up in Minneapolis and such, in Minnesota, in California? We are just exposing the actual fraud to the billions of dollars that's costing this country. Did that ever happen before? No, but it's happening under President Trump. It's happening under Dr. Oz, Mehmet Oz at CMS, Medicare, Medicaid. Let me tell you, he is hitting this hard. The Office of the Inspector General at HHS is hitting this hard, exposing this fraud. We are we are going to save Americans billions of dollars because of identifying this fraud and ending this fraud. That's real affordability when you think about that. That's money that is being stolen away from the American people. We are working hard to put an end to that. That's direct affordability, and that's going on. And it's really disturbing to think that your federal dollars, my federal tax dollars are being sucked away by liars and cheats. But we are working hard to stop that. And I'm telling you, there's incredible work going on with that. Americans need to remember that. Again, remember that every day, but remember that in November as you cast those ballots. If you want to go back, if you want to go to people who would let fraud go on, all you have to do is not vote for the candidates that support the president, and you'll get more of that same garbage.
Have you connected with Congressman Tim Burchett yet, the head of DOJ?
I have not.
Okay.
I have not.
Y'all need to meet.
It has to happen.
I have not.
Yeah, maybe he could help. He is a congressman from Knoxville, where I grew up, and he just was assigned the new chairman of the DOJ committee. So maybe y'all could do some work together.
Yeah,
he's great.
No, I would love to meet that. I would love to meet him. Another thing in terms of, and this bridges the values and actually cost and affordability, the NIH announced that no longer would grants be available or go toward studies using aborted fetal tissues.
Oh, yes.
Okay. Again, Jay Bhattacharya, who is at NIH, he is an amazing warrior for this country. He's an amazing warrior for health. He is a believer. He's a brother in that respect. He's an amazing scientist. But NIH announced dollars aren't going to go toward those grants. So if those studies are going on, the money's going to be pooled. If you apply for grants for studies that use that aborted fetal tissue no longer. So what does that do? Number one, it's a win for life. Yeah. It's also a win for dollars that we have in this country for legitimate studies and research not going toward that kind of stuff. Mm-hmm. Our dollars, the dollars that we pay, tax dollars, will be going towards studies that actually improve health and actually promote life and actually do things to advance the health of this country. Again, is that affordability? 100%, because it'll make the country healthier. We will have better affordability. Our tax dollars won't go towards studies that aren't going to help this country get better. And I think that's huge. I was so proud of when I saw that come out.
And it is huge because it's also very hard for people to even believe that was happening in the first place. There's another, probably along the lines of COVID and you're a vaccine denier. Those kinds of things don't happen, but it did.
They do.
And this is remarkable that it doesn't happen anymore.
Absolutely. Absolutely. Again, so many good things being done. I'm a Catholic Christian. In this administration, you don't have to check your faith at the door when you practice medicine or you want to care for patients. I say this because one of the things that the president is pushing, and Secretary Kennedy is very strong on, is conscience protections. In other words, if you're a physician or you're a nurse or you're a pharmacist or you're a healthcare provider and you say, you know what, this goes against my deeply held faith, my deeply held convictions, under the last administration or under Democrats, you'd be persecuted.
Yes.
You'd be disparaged, right? Not under this administration. So the conscience protections are there. If I was still practicing, I wouldn't have to worry that I was going to be attacked by the left because I didn't want to take part in some procedure that was against my conviction. So conscience protections are very important, but they're really being pushed and really being strengthened by this president and by Secretary Kennedy and all of us at HHS.
Well, the left does not check their religion at the door. So,
No, that's right.
No, their whatever progressive woke agenda does not get checked.
Yeah.
Yes.
Yeah. Okay. So we like to do something a little different. We call it the lightning round or
Okay.
your exit questions.
Okay.
These are like, just be Brian Christine.
I will be Brian
Just
Christine. I can't do
take
any. I
off your
can't do anything
Admiral
else.
hat. These are just kind of to get to know you
Okay.
as a person. So, what was your very first job?
My very first job, I worked at a Baskin Robbins when I was in high school. And I think it was a terrible decision for the individual employed me because I probably spent more time in the freezer eating ice cream than I actually did. No, I didn't really. But I worked at a Baskin Robbins. That was the first job. I did do some work at
Remember Baskin Robbins.
living in Augusta. There's a military base close by, Fort Gordon. And I worked at the commissary there, which was like the grocery store.
Yeah.
And I bagged groceries. And I did that during the summers. And that wasn't, got tips. And so there was that. But the first job that where I actually got paid and all that kind of stuff was at Baskin Robbins.
Favorite?
That's old school.
That's straight up old school.
Yeah.
Favorite flavor?
Oh, favorite flavor, pralines and cream.
Okay.
Absolutely.
It's so southern. Wow.
What is that?
was-
I can't
was in-
believe
I
you
was in
didn't say
Augusta,
pralines.
Georgia.
Well, yeah, praline.
Well, you know, I am an Army brat, so we've moved around a fair bit. But yeah, but it was that was a lot of fun because I ate my way through a lot of ice cream.
And we say bravo. You know,
They're putting in another, like, I haven't seen Baskin Robbins in forever, and I swear I drove by somewhere and they're putting one
I think
in.
they are. I think
I
I know
thought
what
they
you're
were
talking
bankrupt.
about.
And just in case Secretary Kennedy is going to watch this podcast, I have reformed my ways, boss. I know
in the
that
past.
I know that pralines and cream is not very maha, but you know what? A little bit of
no,
sweet
back
now and
then-
again is okay.
No,
This
back
is
then
way
I
back
bet
when.
it was made with like no fake anything. I bet it
Milk,
was legit
sugar.
in the like 80s or 90s.
Could have been.
Yeah.
Yeah,
It was tasty.
yeah. No,
I-
I'm pretty sure. Just maybe don't go work at the new one.
Biggest pet peeve?
Biggest pet peeve I have, I think, is that people will complain but not stand up for what's right. In other words, how many times have I seen, for instance, physicians who complain so much about the government and so much about what's going on in healthcare, but if you ask them to get out and support candidates who support, literally go to rallies or to give donations, because you have to be able to fund campaigns, they won't do anything.
Yes.
That I've seen that with physicians. Now, lawyers, I believe, are 100% the opposite way. They will get engaged and get involved. But there are so many physicians who will complain and won't do anything to help the situation. That is a peeve of mine.
I think that's probably, we could go in that category.
Well, I'm sure you've
gonna-
seen that
yeah.
as well.
Absolutely. It's really hard to get people convinced that what you do matters. But you're right. Complaining without action you're just yapping in the wind. And
You know what? Give
we need more
donations
than
if
that.
you can. Knock doors. You've all done that. We've
Yep.
all done that.
Yep.
Go out there, put signs up, right? Do what you can do. If you really believe that things are a problem, then get out there and do something about it.
That's right.
It's kind of like teachers who, teachers are like the same. They're scared to put themselves out there and do anything to make changes. Like, if we all got together, we could actually do something. I don't know. Is it my turn? Or
It's your turn.
Okay.
It's your turn.
What's one new skill you would like to master because you have so much free time?
One new skill I would
Like
like
a
to
hobby
master.
or something you want to learn?
Yeah, that's a really good question. And I know this is lightning round, but I'm thinking about that. I would say one thing I do want to get better at is because one of the reasons I wanted to be the Assistant Secretary for Health was that because, number one, because with Levine and the last time, I knew there were so many wrongs we had to right. And so that drew me, but also because the role of the assistant secretary, we talked about this, part of the role being communication and being out there, being out front, communicating things to the American people. I want to get better at that. I'd like to sharpen my skills on that. I think because I've had to communicate with people as patients for so long, I think I do a pretty good job.
Yeah.
But this is a new kind of thing when you're doing interviews or you're doing extemporaneous things. I'd like to get my skill set better so that I can better message for the president and for Secretary Kennedy.
I think you're a good communicator.
Yeah.
Well, I appreciate that. We can always do things better, but I
Yeah.
appreciate that.
You're thoughtful and well-spoken, but you're not like robotic.
Yeah.
You talk to a lot of politicians and it's like you feel like you're just getting like a bunch of talking points that they've said a million times. I don't get that with you at all.
Not at all.
Good.
Not at all.
Don't turn into that.
No.
3 more quick questions. 1, what was your nickname growing up?
My nickname, that's interesting. Sammy was my nickname.
Okay.
So my name is Brian Sam Christine. Now, you wouldn't know this by looking at my last name, Christini, but I'm Italian-American. My grandfather, my dad's father, was Biagio Christini, Christini, right? My father's,
Great name.
I know, my father's sister, my Aunt Helen, who has passed, her name was Helen Christini, Christini, on her birth certificate. My dad was Alexander Christine, Christine. And so, my dad could never explain how that change occurred. Who knows? But my middle name is Sam, named after my father's uncle, Sam, who passed away. But my nickname was Sammy, and so part of the reason it was Sammy is because there was Sam. But do you remember? Remember the movie Disney, Sammy the Way Out Seal? I guess you don't. I guess I'm showing my
remember.
age. It was a seal, yes. And so, I love that movie, and so people call me Sammy.
The Way Out.
Seal.
I bet.
Seal, as in not as in like.
Yeah. Did he live way out there, or
Well,
was he
just-
like?
was it a cool? It
Now we're
was
gonna have
funny.
to find
Typical.
it. Single out.
Back when Disney actually made movies that
Yes.
you'd want to take your kids to, right?
Yeah.
So Sammy was my nickname.
Okay, this was my question. You don't have to answer it.
Sure.
But what's RFK Jr. really like? Is he like what you see on TV?
He is. This is going to sound like I'm slinging a line, but he's amazing. When I got so my process was I wanted to serve in the administration, wanted to serve at HHS, and I really was liking the idea. I wanted to serve as the assistant secretary for health. So I knew someone who was in the transition team. I sent my CV, and they said, we've showed it around to people, put a formal application in with the transition team. I did that. Had a couple of phone interviews, and then last year I got the word. They said, listen, we want you to come interview with Mr. Kennedy. And so I went down and I interviewed with RFK. And in the room also was Jim O'Neill, the deputy now the deputy secretary. They were there interviewing me. So I step into the room, and I step into the room with Robert F. Kennedy Jr. It was, number one, it was almost kind of surreal that here I am, the little guy from Alabama who's talking to RFK Jr. He is like you see him. He's a very kind man. He's an incredibly thoughtful man. I'm going to say he's a humble man in that he's not afraid to say, in my life, I've made mistakes. I've had substance abuse issues. He's not afraid to admit mistakes. He's not afraid to admit wrongs, but he's not afraid to stand for what he believes. He's a really kind man. He's a really thoughtful man. So that, again, I believe he's like, to me, and when I've seen him with his wife, when I've seen him interacting with us, it's amazing. So let me give you a story, recent story. I told you that I'm the head of the Commission Corps, the Public Health Service officers. About 2 weeks ago, I got alerted from one of my admirals that one of our Commission Corps officers had done something really amazing. A lot of our officers are deployed to the Indian Health Service that takes care of health care on the Indian reservations for Native Americans and Alaskan Natives. Okay, we staff a lot of the Indian Health Service. There was one of our therapists, one of our mental health workers, who was out in Pine Ridge, which is in one of the Dakotas, but IHS, and was going to a high school, the local high school, and was supposed to meet with students who were having mental health concerns and wanted to talk, and only one student showed up. And so the administrator at the school said, you know what, to my officer, you know what, go home. You know, and this is Lieutenant Fellows. Go home, Lieutenant Fellows. There's only one person here. And she said, no, I'm here to take care of the kids. So started talking to this 14-year-old young girl. The 14-year-old young girl related a history of trauma and abuse, suicidal ideation. Lieutenant Fellows, I'm so proud of her. She stayed with that child. She made sure that the school teachers and all stayed with that child while she got arrangements made to transport that child to a hospital. The child was evaluated, was admitted because of ideation. As they're taking the child into the hospital, in her bag, she had a suicide note written that day, dated that afternoon. She had a noose that she had made. And she said, had it not been for Lieutenant Fellows, I would have committed suicide that day. So I got this word, and I was like, this is an example of why my officers are so important. And so I related that to Secretary Kennedy's chief of staff. And I said, hey, I'm going to call, just to let you know, I'm going to call Officer Fellows later on this particular Friday. I'm going to call to say personally congratulations, because she works normally at the FDA, office in Salt Lake City, but she was deployed out to IHS, to Indian Health Service. Okay. Anywho, I said, I'm going to make a call to congratulate her. So what happens? I get word, Secretary Kennedy wants to make the call with you.
Oh, wow.
So we get on the call. It's a video call. There's my officer. So proud of her. There's my officer. And there's not only the Assistant Secretary for Health, because she was blown away by that, because the prior Assistant Secretary didn't really give a darn about his officers. He wouldn't do things like this. There's the Assistant Secretary speaking to her, and there's Robert F. Kennedy Jr.
Wow.
His words to her were so meaningful. He didn't have to do that. He did that because he saw someone who went above, who saved a life. That's the kind of man he is. When he sees people doing good, he wants to recognize that. And I think he understands the power of someone at his position and in his name recognition, telling this officer, you've done so well. Well done. You were a good and faithful servant. That's the kind of guy he is.
He seems very human.
He is very human.
And that's
I think he is. He's
endearing
realistic. I mean, he's real. So here's another little story. And I told this at an interview recently. My final interview for the process was at something called the Presidential Personnel Office, PPO. So I interviewed at the White House, not with President Trump, but with his staff office. After having gone through multiple interviews, interviewed with Secretary Kennedy and such, I had that interview at the White House. And after the interview, I was escorted out, and they said, listen, they said that Robert F. Kennedy Jr. wants you in the position. The final decision will be made by President Trump. And I wanted to go pray. So from the White House, I walked to the Cathedral of St. Matthew, which is the cathedral for the Archdiocese of New York. Every diocese or every region has its cathedral. In this case, the Cathedral of St. Matthew. I'd never been there before. So I walked down the central aisle because I wanted to kneel in front of the high altar to pray. And at the end of the aisle is a disc in the floor. And the disc says, this is where the body of President John F. Kennedy laid in state, on this spot. And so I thought, I want to go work with a man whose father and whose uncle were martyrs for our republic. Forget the politics. If you don't like the politics of John F. Kennedy or Senator Bobby Kennedy, forget it. They literally were willing to die for this country. I know that RFK would die for this country. I know that Robert F. Kennedy Jr. would shed blood for this country. And so, at that moment, I just hit my knees and I said, God, let me work with this man. And here I am. But that's what he inspires in people. And it's not just me saying this. You talk to anybody at HHS, any of us who've been, put into position there. He inspires us every day. He's amazing.
Wow.
Which is exactly what you have done for us. You inspire us too, and you make Alabama proud. But it seems that we are in very good hands.
Well, that's kind of you to say. I appreciate that. This is a blessing. It is a privilege to wear this uniform. It's a privilege to serve, to work with Robert F. Kennedy Jr. It is a privilege to serve President Trump and to serve our republic. It really is. And so do me a favor, pray for us. Pray for us at HHS. Pray for the president. Pray for Secretary Kennedy. Pray for me. Pray for all of us at HHS trying to do good work, because we need the prayers. Because I'm sure there's enough people on the other side who wish us ill, but pray for us, because that's really meaningful.
We will.
Well, y'all do a good job. Just stand in truth. Don't back down.
That's right.
We got you as much as we can. But y'all are doing great work. I mean, just in a few short months, I feel like really putting out and changing a lot that needed to be done. So
we are doing so much. There's so many good things happening under this administration, but we're doing so much at HHS. And it's venues like this that get the word out to the people, because you're never going to hear it from CNN and all those other ridiculous networks that all they do is lie to the American people. What you're doing is speaking truth. And I tell you, you aren't just some shells for the administration. You people stand on truth. And, if you see something go right that you think is good, you'll say it. But if you see something that's not good, you'll say it as well. And that's what we need for the people to understand. They need to hear this so that when November comes, I'm going to say it again, get out, vote. Yes. Vote. In all of these districts across the country, support our congressional candidates, all up and down the ballot, but support our congressional candidates who line up with President Trump. Because if we don't, they're going to be trying to roll things back.
Well, thank you for being here today. Come hang out with us next time you're back in Birmingham. Do you get to come home often?
I do. I don't come home often enough. I've really got to make it a point to come home. I need to come home a weekend a month or a weekend every 5 weeks or so because I need to see my granddaughters. And actually, as of Thursday, my grandson, my first grandson. So praise God.
Oh, congratulations.
But I need to come back more because it was when I stepped off the plane the other day,
you're like,
I was like, I'm back in Sweet Home, Alabama. I do miss this place. I'm so happy to be doing what I'm doing, so privileged, but I miss this place.
Yeah, we'll keep you grounded.
Yeah.
That's good.
We'll keep you just Brian.
That's good. I like that. That's what I need.
But you're welcome anytime.
You are welcome anytime. Maybe we'll come to D.C. and
Please
do something.
Yeah, we'd love to.
Check out your new office, which actually is your office, Richard's, Rachel's. Okay.
Yeah, it is.
Now we have to go.
Now we got to go check it out.
Yeah, come check it out.
Yeah. Well, thank you.
You're welcome.
Really appreciate it.
Y'all have a blessed day. Thank you very much.
Thank you.
Pray for us. I'll pray for y'all.
Bet.
Okay.